This is Dr. Aditya. You have seen me several times on this platform, probably talking about some guideline or rattling on about a surgeon or discussing some OSCE or some OBGYN nugget. But today I'm not here. I'd come up in a similar video a couple of months ago when I intended to launch CRISP OG. So in that CRISP OG, we had mentioned that in the subsequent 2 months, that is June and July, we shall be having lectures which shall be hyper brief, which means that the lengths would be quite short. So it would be very good for residents who shall be viewing it, so that in the evening hours, they don't have to spend a couple of hours on one lecture. So maybe 45 minutes to an hour per lecture, so that I can easily watch it that day or on the next day. And we had mentioned that we shall be getting all the specialists of those subjects to talk about those topics. So, as we had promised, the time duration was 45 minutes to 1 hour consistently over the last 2 months, and we got several specialists on our team for several topics, which included an oncosurgeon, a robotic surgeon. We also had several fetal medicine specialists. We have now with our team an endoscopy, a gynecological endoscopy specialist, and hence we already had core OBGYNs. So all those specific topics were discussed by those specific specialists who have expertise in them. And as I have said that there are several other platforms which teach, but what pertains to us or what we believe in is having a very family-like atmosphere. And when I say family, it's not just for the sake of saying. Now, we have mentioned on several occasions that we have a group on Telegram on which we have 24/7 discussions on whatever queries, whatever dilemma our subscribers get, be it in the ward regarding treatment or regarding management, or how they already treated and what better could they have done or what differently could they have tried or attempted for that patient. We also, from our side of faculty, we put in a few clinical images, put in several case scenarios, and we take the opinions, we seek on as to how would the subscribers, our students, would have managed these patients. And it's an active discussion, and that is what a family does. They have an active they have an active discussion, and there are no inhibitions. Kuch bhi doubt ho, kya hi ho, just ask them and we shall clear it out. So it's an ongoing conversation from both ends, and I personally love it a lot. Apart from that, we also believe that we have to keep on reinventing ourselves. So we have to keep on incorporating new suggestions, newer things. And there are a couple of new things that we are coming up with from the month of August. The first one is going to be a quiz, a Kahoot quiz. Kahoot is an app, KAHOOT. So a few of you all might know it. It's an app on which professionals do quizzing, and none other than Dr. Raina Chawla herself is going to conduct the quiz this month. She has been one of the better teachers that I have seen in OBG over the course of my OBGY career. And I don't believe there could have been a better person than her to take those quizzes. So she'll be conducting them. Also, we shall be having two mock exam sessions from this month. Now, in the month of July, we had one session that was on anemia in pregnancy. We had Dr. Jyotika as the examinee, as a student who delivered the case. She's an exam going student from GMC Surat. And on the other hand, we had faculty, we had externals from reputed colleges, which included MAMC and AIMS Delhi. So they were quite experienced ex-HODs and ex-heads of the department that we had from those hospitals. And it was a great session. It was a session that was open for all. And the reviews that we received were so amazing that we decided to make two such sessions every month, fortnightly from August. So we have two sessions this month. The first session is going to be on 9th of August. The topic is going to be AUB leiomyoma. So abnormal uterine bleeding due to leiomyoma or a fibroid. So a classical case on fibroids with a little discussion on AUB due to other causes. And the other one is going to be an obstetric topic, that is hypertensive disorders in pregnancy on 23rd of August. So save those dates because these two sessions are going to be again free for all, but the examinees, the students who shall present those cases shall be exclusive for subscribers, but it can be viewed by everyone. So we shall be having newer faculties, newer externals, and we have gone that extra yard to ensure that the quality of our external examiners is never compromised on. And we have gotten yet another new set of amazing, reputed, knowledgeable, extremely knowledgeable, I'd say, teachers from our field, from our fraternity, to be external examiners for those cases. So I would want a lot of you all to participate, to actively be a part of those two sessions. Apart from that, we also have decided to change the pattern in which our lectures were being conducted. So from now on, every week shall be allotted to one faculty, in which over the course of that week, we have lectures from Monday to Friday. So over the course of that week, we shall have 5 lectures. Of them, they shall all be on the same topic, on a single topic, which will be split into several smaller parts. As I mentioned, that our lectures are going to be hyper brief. So we won't have lectures that are of a length of like 2 hours at a stretch. So there'll be smaller topics, 45 minutes per day, subtopics, which will cover the entire topic over 5 days. Of them, the fourth and fifth day shall be when we sum up or we summarize the entire topic, so that if any student has not managed to watch a lecture or two because of the residency duties, because of the emergency duties, they can still cover up for it on that last day when we summarize the entire topic on that lecture day. It will be a lecture that will be dedicated only and only for summarizing what we have already taught. So also having a single faculty for the entire topic is going to ensure consistency and continuity of that topic. And that is something that we have decided to change, to shuffle up a bit. And it also keeps us excited. Trying new things keeps us as teachers, as faculties excited to try on new things. And hence that is one thing that we have done. And we have also gotten a few newer faculties who we believe are amazing teachers on our board. And you shall know about them very soon. So lastly, I would like to thank you all. It is like we complete 4 months on 2nd of August since we started off, and the response has been heartwarming. We have loved every bit of it, and it has just begun. We shall be going a long way ahead, and we all want you all to be along with us on Conceptual, the family that Conceptual is. And I shall see you in yet another lecture on our app, Conceptual OBG, and I hope to see a lot more students coming up with each passing day to feature on all our different programs that we have started. We have gotten several features now, be it the quiz or be it those OSCE discussions that we shall be having for all the DNV students, especially for the practical exams of DNV students, and all those mock exam sessions, and of course, our live lectures that we conduct every single day. So, Dr. Aditya signing off. Of course, I had a background over here. I sit in Mumbai, but I have chosen a very realistic background wherein there is snow outside my window. So, let me go and enjoy my Mumbai snow in the month of July. Until then, I shall see you yet again 2 months down the line. And I hope to have you all tell me that you all enjoyed these months, these sessions with us. Thank you for your response, and we love you all. Keep watching Conceptual OBG. See you soon. Very again. Signing off, Dr. Aditya.